Today, we're diving into a condition that's famous for its absolutely excruciating pain, gout. We're going to break down this complex topic into a clear visual story.
Okay, so let's jump right in with the most dramatic part of gout, the very first attack. Picture this. It often hits you in the middle of the night, waking you up from a dead sleep with this feeling like your joint is literally on fire.
And this is what it looks like. This is a classic gout flare, and when it's in the big toe like this, which happens in about half of all first attacks, it's called podagra. You've got this super intense pain, swelling, and redness that just explodes in a matter of hours, peaking within 12 to 24 hours. And even after the worst of it passes, that discomfort can stick around for days, sometimes even weeks. So what on earth is causing this agony? Well, to find the real culprit, we have to look deeper, beyond the joint itself and into your blood. It all boils down to a chemical imbalance.
It all starts with something called hyperuricemia. Now, uric acid is a totally normal waste product in our bodies. The problem is when the levels get too high, specifically above 6.8 milligrams per deciliter, because that's the point where it can't dissolve in the blood anymore. But get this, and this is really key. Just having high uric acid doesn't mean you're going to get gout. Lots of people have it and never have a single symptom.
And this is the true culprit. When those uric acid levels get too high for too long, the acid can start to form these tiny, incredibly sharp crystals inside your joints. What you're looking at here are monosodium urate, or MSU crystals, under a special microscope. They literally look like little needles. And you can imagine what happens next, right? Your body sees these microscopic shards of glass in your joint and totally freaks out. It launches this massive inflammatory attack, sending in white blood cells to go to war with these crystals, and that battle is what causes all this signature pain, heat, redness, and swelling of a gout attack. Okay, so after that first attack finally cools down, you might think, phew, I'm in the clear. The pain's gone, life is back to normal. But here's the thing. If it's left untreated, the disease is just getting started, and it follows a really predictable pattern. The disease really moves through 3 distinct phases. You have that first, unforgettable flare. Then you go into these quiet times in between attacks, called intercritical periods. But without treatment, this can eventually progress to the final stage, chronic gout. And this is the part that so many people miss. During those calm periods where you feel perfectly fine, the problem hasn't gone away. Those little crystals are still there, silently building up in your joints, basically setting the stage for the next attack and for long-term damage. And this comparison just says it all, doesn't it? On the left, you've got that temporary, fiery inflammation of an acute attack. But on the right, that's the result of years of that silent crystal buildup. You can see the permanent changes to the joint, those visible bumps. That's chronic gout. Over time, those crystal deposits can clump together and grow into these larger masses called tophi. Think about this. On average, it takes about 12 years of untreated gout before these tophi start showing up. They're basically just giant packed collections of those same needle-like crystals. And they can show up in some classic spots, like right here on the outer part of the ear. You can also get them in your joints or tendons. Now, the tophi themselves usually don't hurt, but they are a massive red flag. They're a sign that the disease is uncontrolled and is starting to cause real physical damage to your joints. All right, so let's put on our detective hats. With symptoms this dramatic, how can doctors be absolutely sure that it's gout and not something else that just looks like it? The absolute gold standard, the #1 way to know for sure, is for a doctor to go right to the source. They use a needle to draw a little bit of the fluid from inside the painful joint. If they put that fluid under a microscope and see those telltale needle-shaped crystals, boom, diagnosis confirmed, it's gout. But, that procedure isn't always an option. Maybe the joint is just too small or hard to get to. So how do doctors get confident about a diagnosis then? Well, they can use a really clever clinical rule, like this one here. It's like a scorecard. They add up points for different clues. Things like being male, having a history of attacks, or having high uric acid in your blood. If your score adds up to 8 or more, the probability of it being gout is super high, even without ever seeing the crystals. Modern imaging is also a game changer. An ultrasound can spot something called a double contour sign, which is basically a bright white line of crystals coating the cartilage of the joint. And even cooler, there's a special kind of CT scan that can actually color code the urate deposits, lighting them up in green so you can see them plain as day.
Now, because the symptoms are so intense, a hot, red, swollen, really painful joint, it is absolutely critical to tell gout apart from some of its common lookalikes. The number one imposter is a condition called pseudogout. I mean, the name says it all, right? Fake gout. It looks and feels a lot like gout, but it's caused by a totally different crystal, calcium pyrophosphate. These crystals are shaped differently, more like little rods, and they tend to show up in bigger joints like the knee or the wrist. But way more urgently, a doctor has to rule out septic arthritis. That's a bacterial infection inside the joint, and it's a true medical emergency. A skin infection called cellulitis can also look similar, causing that redness and swelling. And of course, you've always got to consider an injury or other kinds of arthritis too. So if you remember just one thing from all of this, let it be this. Gout isn't just a series of bad days. It's not just about the attacks. It is a chronic 24/7 disease of crystal buildup that's happening all the time, even when you feel completely fine. And that really leaves us with the big question, doesn't it? If those crystals are always there, silently doing their damage, even between attacks, what does that mean for how we treat this? It totally shifts the goal from just putting out the fire of an attack to actually managing a chronic condition for the long haul, to stop those future flares and prevent that silent but devastating joint damage.